Mm-hmm. That's okay. I don't see anybody on here yet, but I'm gonna start. Hi, everyone, and welcome to today's live session, Your Path to a Healthcare Career with CIHE. I'm Dr. Clemens, the CEO of the Cultural Institute of Health and Education, or CIHE, and I'm thrilled to connect you with all of you who will either see this live or in the future. Whether you're a current student, a potential student exploring healthcare careers, or a supporter of CIHE, you're in the right place. Today, I'll share how CIHE can help you kickstart a career in healthcare, answer your questions, and inspire you to take the next steps towards success. While here live, feel free to drop your comments or questions in the chat. I'll answer as many as I can, but I will hold off until the end to answer your questions. Matter of fact, let me make sure I open up my chat. Okay. Um, so let me tell you a little bit about myself, and then I'll tell you a little bit about CIHE. I am a nurse. I've been a nurse for 20 years. I grew up in Philadelphia, but I didn't start off my career as a nurse. I started off as a medical assistant in the early 90s. And my career path or my choices that I made in life led me to become a nurse, even though I never had a goal of becoming a nurse. I just knew that healthcare was a strong point for me, and people along the way helped guide my career choices to help me become a nurse. And not only did I become a nurse, which was, the initial thing that I set out once I got on a different career path, I ended up becoming a nurse professor, and then eventually I achieved a PhD degree. And um, during that path and along the way, I started my nonprofit to help people in the same way that other people help me. And my goal is to always have a free program for individuals going into the entry level in healthcare in the same way I was helped, and hopefully guide their career in the same way mine was guided. So our mission at CHE is to provide affordable hands-on training to empower students for rewarding careers in healthcare. Right now we offer programs like phlebotomy and EKG technician training, which will lead to a certification. And it's designed to help you get into the workforce quickly and in order to build on your skills to guide your career choices in the future. But it's not just about skills, it's about preparing you for real life healthcare settings with support every step of the way. For example, we helped one of our CIHE graduates achieve her certification in phlebotomy, and eventually she opened up her own mobile phlebotomy business, and that business is now thriving. So that's what we do here at CIHE. We help you achieve your goals, whatever those goals are. So now I'm gonna dive into how CIHE sets you up for success. So our programs are hands-on and focused, especially our phlebotomy program. You'll learn technical skills in healthcare that employers are looking for, so that even if you're new and you don't have any skills, you are prepared to learn and build on those skills. So, for example, we have didactic education for phlebotomy, and then we also have hands-on skills where you'll practice on mannequins and then eventually practice drawing blood on humans. Our EKG course is more online and self-paced. And when we do bring people in person for the EKG course, is more to prepare them for the certification, because the EKG course is about like learning the structures of the heart, and then also the anatomy and physiology, the pathways, and most importantly, being able to read the strips. And that's all provided on the education platform. But we do occasionally bring people in person for the EKG course so that we know that they're prepared to take the certification exam and successfully pass the certification exam. We also have partnerships with employees. We work with healthcare institutions in the area like the Greater Philadelphia Health Action, who will guarantee most students at least an interview. And upon successful interviews, they can begin to work with the Greater Philadelphia Health Action. And to ensure that we meet the needs of the employers, we work closely with them to figure out what their needs are, and we prepare the students to fulfill those needs once they finish the programs and get certified. Many of our students find jobs upon completion of the program, and they're quickly snatched up by the industry. CIHE supports students every step of the way from enrollment and certification. We guide students through the process. We even offer resume building and assist with resume tailoring resumes to what we know people in healthcare are looking for. And then if students need it, we do mock interviews or prepare them with mock interview sessions. We're also working with the Philadelphia Urban League, where we will do career workshops so that we can ensure that people are prepared and ready for going into the workforce once they complete the programs. And then opportunities for growth. Many of our students start in entry level positions in the same way I did, and I explained in the beginning, and then go into higher roles like nursing. We do sometimes have people that are already enrolled in nursing or higher education programs who want to get some more foundational knowledge before they're graduating. So we have nursing students who come to learn for about phlebotomy. We have actual practicing nurses who come to learn the EKG course. So our courses are opportunities for growth for individuals who are looking to get some foundational knowledge and before they go into these more advanced careers. So now let's hear from you. Even if you are looking at this in the future, you can comment on the video and hopefully we'll get back to you with any questions that you have. But if there's anybody on here now who has questions, you can send your questions now and I'll do my best to answer. Waiting on questions. All right, since there's no questions at this time, I am going to wrap this live up. Note that I will be going live once a month, and everyone will get a chance to come on and join our live. And if they have questions before the live, they can come to the live with their questions or ask them at another time. I will be going live sometime in February. Um, and you'll get a notification for that. Also note that we are enrolling, or we're preparing to enroll for the next phlebotomy session that will occur at the end of this month. We are, I see Kiana has a question. How can I register? So, Kiana, hopefully I'm saying your name correctly. If you could send an email, send your email in the chat, or not in the chat, in the send us an inbox message with your email. We can add you to the our listserv, and then you'll get an invitation. But I can tell you that we're having an info session on Thursday, the 16th, at Drexel's Dornsife Center for Neighborhood Partnership. And once I get your email address, I can send you the form to sign up, and then you can join that info session. During that info sessions, and during that info session, we'll be doing interviews to admit individuals to our next cohort, which we'll be having 3 cohorts at different locations, and based on what your availability is, if you are successfully interviewed, you'll be added to one of those cohorts. So get us your email address, and we'll add you to the list. And those individuals who don't get added to the up and coming cohort, we will have another cohort starting in the end of March. And then the same thing will occur. You'll be invited to an info session. After the info session, you'll get an interview to be signed up to attend the info session and get interviewed, and then you'll be able to start if you successfully interview. You're welcome, Kiana. Hopefully I'll see you on Thursday at Drexel. All right, since there are no other questions, I am going to wrap this live up and hopefully see everybody at the next live session or at in class. Have a great day, everyone.